Hi everyone, I'm Dr. Cheruba Prabakar, OBGYN.
And I'm Dr. Rachel Yakrus, OBGYN.
Hey, how was your day on Friday? You told me you had like 25 patients on your panel.
Yeah, I did. I had a very busy schedule. It was a busy day. Everything was going well, but then at 3 p.m., this patient came in and her only complaint was hemorrhoids. And very specifically, she said she was having a lot of bleeding and she wanted a procedure done, to fix the problem. And I didn't really know where to send her. I scrambled and I referred her to a GI doctor, but I don't really know if that was the right thing to do. Do you know who I should refer that patient to?
I think it's actually general surgery. I know general surgeons do hemorrhoidectomies. I
Mm-hmm.
spoke to one about all the different types of procedures they can do. It's pretty
Okay.
complex from what I know, and
Okay.
I think
Yeah.
I'm pretty sure it's general surgery.
All right. I feel so bad. I just feel like I don't know that much about it. And I think maybe 4 or 5 months ago, there was some sort of lecture about hemorrhoids and other techniques and surgeries. But I'm in San Pablo. I'm not across the street from the hospital where they do these lectures. And so I just feel like it's hard to keep up to date with clinical knowledge, especially outside our specialty. Knowing who to refer to, it's just a big challenge for me.
Yeah,
Yeah.
I agree. And so we're introducing this Project Meet Up. The MEET stands for Medical Education Enhancement Together. And the goal of this project is really to develop a strong network within UMP, get to know our providers, get to know our special interests so we know who to refer to, and we're in different locations around UMP as well. And just, so we can take better care of our patients. Do you want to tell us a little bit more about the details?
Sure. So you can refer to our PowerPoint for some more details, but briefly, these meetups would be about once a month, and we would recruit hosts from different locations within UMP. And each host would invite a colleague from another specialty. So, for example, I would probably invite Dr. Moynihan, and she's an endocrinologist in San Pablo where I see patients. And I am always referring patients to her, and I always have a lot of questions about thyroid disease, especially in pregnancy. And I'm sure family medicine doctors that take care of low-risk pregnant patients would also have some questions for her as well.
Sure.
So I would invite her, and we would coordinate a date and time for the meetup. And it could be a 5 to 6 p.m. coffee, or an 8 to 9 p.m. drinks, or even wine and cheese at my apartment in Berkeley. And we would send the invitation out with the specifics to UMP and any other providers who would be interested in, discussing some clinical topics with an OBGYN and an endocrinologist could RSVP. About 5 to 6 providers a session is, I think, a good number. And at the end of the session, we would send out feedback to all the other providers within UMP with some clinical pearls. Anything we learned about the other providers. For example, I do late-term abortions. If someone has a fetal anomaly, it's a very difficult situation, but I can help take care of those patients. I do a lot of contraception. I know that you do minimally invasive robotics. And through these meetups, we can showcase our clinical interests and also network, get more contact information from our colleagues, and also have an activity, some social interaction. I'm just by myself all day, and it can be tough. So I think it would help solve a lot of those problems.
Yeah. So again, the project meetup is not really meant to add on a lot of time and work to our already busy schedules. It is an hour a month of just social interaction with our peers and colleagues, and especially we want to stress it's interdisciplinary. So we learn a little bit more about other specialties and the appropriate type to refer and who to refer to, and learn about our special interests so we can all work together to take better care of our patients.
Yes.
Thank you.
Thank you.